Okay. I've been tasked to talk to you about improving community health, policies, systems, and environmental change. And that's actually academic speak for it takes a community to move from the sick care model to the wellness care model. So what I'm going to do today is talk a little bit about changing the context, and then I'm going to focus in on what do I mean by policy, systems, and environmental change. And then from there, we're going to actually give you some examples of strategies that work. And then I'm going to reflect in terms of what Dr. King talked about in focusing on program evaluation and looking at measures to determine success. And then finally mention a few next steps that will happen this afternoon. So I think when talking about changing the context, it's really helpful to read this quote to you from the Institutes of Medicine. It says, "It's unreasonable to expect that people who change their behaviors easily when there are so many forces in the social, cultural, and physical environment that conspire against such change." And if you look at that figure over to the right-hand side, I have lots of figures, no squiggly lines, but in this figure, the innermost circle is the self. And when we look at the self, we're looking at how much information, how much knowledge does that person have? How much motivation do they have for behavior change? Are they have the ability to make behavior change? And what are their norms? And again, as mentioned by Dr. King, what culture did they grow up in? Was it normal to see people smoking in their household? Therefore, it's a normal behavior. And you take all of that and you look at all the other factors in a community, from relationships with people to organizations, that you could really see how hard it is and how many forces there are that challenge behavior change. And again, this slide shows you some pictures of that, looking at trying to go for a walk where there's no sidewalks, a child on a bicycle in the middle of the road, or having to walk at night when there's no adequate lighting. I love the looking at, by the way, how well are we doing with our planning with that pole in the middle of the sidewalk? And then the fact that, you know, in terms of making food choices, we have the fast food restaurants. That map dots the density of all fast food restaurants. The gentleman in the lounge chair, it does have his channel changer, you know, so we're looking at physical activity. And then looking at smoking and tobacco, and the center slide in the middle is one of the pop stars. And so here she's smoking, and so how does that influence our young kids in terms of looking at what is normative behavior? And then the fact that some people will not have the access to health services, wellness services, and they use the emergency department for care. What we want to do is we want to change this context. We want to be in an environment where the environment doesn't support smoking, okay, where there's lots of opportunities to have fruits and vegetables and make good, healthy food choices when we're not home available, when we have the ability to look at coordination of care either at the workplace or other mechanisms in a community where we can make sure that we're getting the adequate quick care we need. And then again, looking at urban planning, where there's good walk paths and bike paths, and not having to rely on transportation. So what is policy, systems, and environmental change? And I think the best way to take a look at it is this figure, which is called the health impact pyramid. In the top of the pyramid, what we're taking a look at is our current, as Dr. Turner has mentioned, sick care model, where we have our clinical interventions. We go to the doctor tells us what to do, gives us some information within 2 or 3 minutes because that's all they have, that's how it's built into our sick care model, and off they go. And we're just wondering, you know, are they able to make these behavior changes? The reality is that in this model has the smallest impact. We're not really reaching a large group of people. If we go down to the bottom of the pyramid, and right here, we're looking at the importance of looking at the determinants of health and looking at how can we take our community and really allow our community where it can facilitate behavior change. And the way to do that is looking at policy, systems, and environmental change. So what do I mean by policy change? We all know what policies are. We all work in organizations. We've probably written policies ourselves. And so, but these are the passings of laws and ordinances and resolutions, regulations, or rules. And we, as I mentioned, all organizations do policies. So when we talk about policies that could potentially support healthy behaviors, smoke-free workplace laws, looking at a school policy where the snacks that are provided when you're fundraising are these similar to what we would want to have that don't have junk food in them. And looking at another policy in a community could say, okay, we got vacant lots, let's go ahead and open them to community gardens. Systems change work with policies. And again, we're looking at the focus of changing the infrastructure of a school or a park or a work site or any kind of health setting. So a systems change, again, could be having community gardens available, having a certification program within a school system where the after-school snacks will match what the school's wellness policy is, or for municipalities, if you're going to be looking at projects, doing your own health impacts assessment, which is actually fairly similar to the community needs assessment, to see what you're planning and how that will impact health. And then environmental change is really looking at the physical environment, economic or social environment. So examples of that would be having the appropriate sidewalks or walkways throughout our community, looking at healthy food options, healthy vending machines in our community, and making fresh fruits and vegetables available to all in all neighborhoods. Here in Pensacola, we do have issues with food deserts where there's the inability of having grocery stores that have fruits and vegetables or affordable fruits and vegetables, and so that's a real issue. So what I'm going to talk about now towards the end of my, my presentation is what works. And the good news is that we actually do know that things work. I think a lot of what Dr. King says is really, really important. You've got to know your community. And so, again, there are these broad-based strategies that we know that work, that they're evidence-based, but then you need to bring them into your community and then really look at to see what is unique about your community in terms of is this the appropriate strategy for the community. First of all, we know that within the work site setting that smoke-free policies do work, and that is a recommended strategy. And so, you know, looking at the fact that you can either have signage that will say smoke-free workplace, thank you for not smoking, or signs around the different laws or policies that are made about smoking outdoors, that these strategies are appropriate. In context to that, when we look at smoke-free workplaces, many times we're looking at providing free or reduced costs for smoking cessation therapy. And there is research that shows, there's one example here, that when this is a part of a comprehensive program, that employee prevalence rate of smoking will decrease from 40% to 25%. And again, having this in combination with cessation incentives and competition, we know that also will help in terms of decreasing smoking. So things like cash and grand prizes, self-help groups, helplines, and classes followed up by, we used to go phone calls, but now we're doing texting, coaching now with the new technology. We do know that some of those are strategies that have been effective. Moving from tobacco in terms of looking at overweight and obesity prevention, I'd first like to talk about nutrition. And again, having the availability of fruits and vegetables in the workplace, in the schools, in the churches, in food banks, and other on-site food service venues is very important. One strategy that can be very low cost is really promoting the increased access to drinking water. And there's been a lot of campaigns just in school systems just talking about the benefits of drinking water. And again, that will then increase the intake of water, but then decrease the intake of sweetened beverages that are calorically dense. We also know that providing nutrition information on menus or point of choice, and we've got a couple examples here where we have a checkout where there are fruits there versus the energy drinks or the candy bars. And then we have the logo from our local health department that goes on, that talks about healthy restaurants that are available in the community. And I know that many times we've gone into restaurants where we'll see like a heart logo or some other healthy logo in terms of making food choices. Moving to physical activity, in the workplace, we do know that providing physical activity options will work. 10-minute breaks for walking instead of turning out we always have our lunch at our desks, making it a walking lunch break. Looking at team competitions or incentives, looking at fitness programs and buddy systems, all are positive strategies. We know that reducing out-of-pocket expenses for employees' gym memberships, and then lastly, looking at point-of-decision prompts to use the staircase. And in this particular company, they cleaned up the staircases, made them very bright and inviting, and they made it choose your trail. So they made it, they did a marketing campaign to get people to walk the stairs. And then lastly, looking at what works health management. And there's two areas that fall into this particular strategy. One of them is improving access to preventive care. So we are going to hear from our next panel in terms of looking at the options in the workplace. We do know that worksite wellness programs that have health risk assessments in combination with feedback and education are a strategy that work. For those individuals who are not employed or who are underemployed, we know that it's important to look at how can we work with these groups of individuals to get the appropriate access to the right type of care instead of using emergency departments to go more towards this concept of medical care homes, which really provides the coordination of care. Then the other area that works in terms of health management is really advocating prevention, health coaching, and chronic disease management when you're looking at your health plan. So again, having a health plan that provides HRAs with feedback and education, looking at wellness care management, providing flu shots, different types of health screenings, and looking at self-care programs so that you might identify employees that have chronic diseases and then have programs that will provide self-care skills for them to improve their health care. So before I end, I want to reiterate what Dr. King has said, the importance of program evaluation. And we really need to look at, and you kind of have to think about this as a roadmap. If you go off on a trip and you don't know where you're going, it's going to be a little bit more complicated to get there. So we first of all do need to know what our current health status is. What is the baseline? And a lot of that's been done with the community needs assessment. You can also look at the health risk assessments that you do in the workplace as an example of looking at your current health status. And then you need to decide, what do you want to change? And again, I think it's been mentioned earlier, that you need to pick, small, identifiable changes that you want to look at. You don't want to look at everything. You need to kind of narrow it down and focus on what you want to change. And then you need to adapt a plan for implementing that change. And then following up with short-term, medium-term, and long-term measures to see whether or not that change became about. I'd like to kind of tell you a little story in terms of how we can kind of think about that. I am currently the chair of the Health Solutions team, which has been a part of the United Scambia efforts. And one of the focus of the Health Solutions team is trying to increase vegetable intake in children. So we looked at the strategy of school gardens, okay? And so we've been very, very successful in Escambia County in growing school gardens. In 2006-07, there was one school garden. We now have over 50% of our elementary schools with school gardens, okay? So we see the gardens built, we see the vegetables, we see the kids with the vegetables. Have they improved their vegetable intake? No, we don't. Okay, so that's the example, okay? When we're starting to look at the things that we're going to talk about this afternoon, we've got to start looking at our measures, okay? And I've been on everybody that knows me for the past, I think maybe 9 months, I've been on the challenge of looking at, have we improved our vegetable intake? And I think that I can safely say that there are some indicators that that has happened in some of the schools here in Escambia County, but we're still working on trying to identify the appropriate measures in the future so that we don't have to end up going backwards and digging through records to get the answer to that question. So in summary, I've just provided you an overview of strategies that are available. I think what's going to be exciting is our next panel, who's going to come. They're going to come up and talk about what has worked in Escambia and Santa Rosa County. And I think it's important to read this quote. "Never doubt that a small group of thoughtful, committed citizens can indeed change the world. Indeed, it's the only thing that ever has." Okay, so thank you very much.